Hi, Dr. Garima here again, and today we'll be discussing about a very important topic, and I've tried to simplify this topic as much as possible because though it is a simple topic, but because of the usage of almost same terminologies, even though you know the answer, you end up making a silly mistake, and that silly mistake proves to be very costly, causing you your exam. So, we are going to talk about antibiotic prophylaxis today. The thing is that in therapeutic guidelines it's very clearly mentioned the table and everything about it, in which condition to do what, and yet because therapeutic guidelines doesn't often provide clear definitions with examples, even though you have the information, because there are no questions provided which I'm making and sharing, and the ones which are coming in the ADC exam, candidates get tend to get confused, especially the freshly passed out graduates, because they haven't had exposure to these scenarios in clinical settings, which results in them getting confused. Because see, once you practice, you retain that information more clearly in your head. Okay, so anyways, before I lose your attention span, let's dive deep into it. Before solving any question on antibiotic prophylaxis, you need to understand two simple things. Let's look at the screen. There is a surgical antibiotic prophylaxis and there is an antibiotic prophylaxis in general. To simplify the concept in the most clear way, a surgical antibiotic prophylaxis is given to prevent infection on the surgery site. Get my point? Surgical antibiotic prophylaxis is used to prevent infection on the surgical site. Antibiotic prophylaxis in general, if I'm not using the word surgical, if I just say this patient needs antibiotic prophylaxis, this is to prevent infection in general, not just limited to the surgical site. Are you getting my point? So, having understood this, please write these two definitions very clearly. Only if you understand these definitions, you would be able to solve any question. Otherwise, you will make such silly mistakes which even you won't realize, and then you will think, I knew this, how could I make a mistake? Because you didn't have your basic definition in the right place. It's like left and right, really. The answers, if I ask you, haven't given the same question and just changing the word surgical antibiotic prophylaxis or just antibiotic prophylaxis, the answers are opposite. It's that different when it comes to solving the answers of the same question by just changing one word. That's why remember this definition. Okay, again repeating, surgical antibiotic prophylaxis is given to prevent infection on the surgery site. Antibiotic prophylaxis is given to prevent infection in general. Now, what is the purpose of giving a surgical antibiotic prophylaxis? Like I mentioned, it's to prevent surgical site infection. And what is the purpose of giving antibiotic prophylaxis? The general one is to prevent infections in various sites, but usually it's the heart, but usually it's to prevent infections at various sites. Timing. When would you give a surgical antibiotic prophylaxis? It's just before or around surgery. When would you give a general antibiotic prophylaxis? It's before potential bacterial exposure. Any bacterial exposure, not just on the surgical site. Duration. Usually surgical antibiotic prophylaxis are a single dose. General antibiotic prophylaxis can be single, can be extended, going towards different doses just in the same day, or it can extend to multiple days. Examples. Say, when would you give a surgical antibiotic prophylaxis? Like before a jaw surgery or an implant. And when I say surgical antibiotic prophylaxis, what kind of population? Surgical patients, which can be healthy or unhealthy. You understand? So even healthy patients, if you're doing a major surgery to prevent infection on the surgical site, you would give surgical antibiotic prophylaxis. Now, what is the example for an in a general antibiotic prophylaxis? That's before dental work in heart patients. What is the population? High risk individuals. That's immunocompromised and any infective endocarditis. So a simple good example is if a healthy patient comes to you for scaling, would you give a prophylaxis? Antibiotic prophylaxis. Did I use the word surgical? I just used the word antibiotic prophylaxis. In a healthy patient, you would not give. But if a patient with infective endocarditis comes, would you give? Yes. Now, I'm doing a third molar surgery, a very complicated one, in a healthy individual, which will require lot of bone drilling. Would I be giving surgical antibiotic prophylaxis or will I be giving an antibiotic prophylaxis? I would be giving a surgical antibiotic prophylaxis. So now see, listen to my question, how I'm going to trick you. A healthy 30-year-old female comes to you and you have to do a very complicated third molar impaction surgery. Would you be giving this patient antibiotic prophylaxis? You will think it's a complicated surgery, yes. No, you would not give antibiotic prophylaxis. You would give surgical antibiotic prophylaxis. But in my question, did I mention the word surgical? No, I just mentioned the word antibiotic prophylaxis. I know the medicine given is the same, but still the definitions are completely different. Now you get my point, why this is so important and why you can make such a goofy, silly mistake just by omitting that small word surgical and seeing the word healthy. You get my point? We will be solving questions on this topic. Now, I have taken great efforts to prepare as many clinical scenario based questions from therapeutic guidelines on this topic. In this video, I'm going to solve just 5. There are other 15 different scenarios that I've made. Eventually, as and when the time comes, we'll solve that. Also, I'm preparing a book which is going to be such a good news to you all. That book is going to comprise of around 100 scenario based questions from Odell, around 50-60 questions from therapeutic guidelines, all clinical scenario based questions with proper scenarios and options and answers and explanations. Because I have received so much request that can you please give us some questions from therapeutic guidelines, infection control, ethics, professionalism, public health dentistry, and Odell, that I'm like, you know what, I cannot keep making videos in such a short timeline on all these topics, because each video I like to be detailed and informative so that it goes here and sticks in your brain. But if you have a textbook which has solved clinical based questions, just one book which takes care of your 15 different study materials properly answered with explanations, won't that be nice? So yeah, I'm in a process of doing that. I need like another 2 weeks probably to finish that. It will completely have like around 500 scenario based questions. I'm really working hard on that because it's tiring for me also to answer each and every candidate, and when they ask how do we solve the questions if they come from Odell. I know that book is lovely, but it is just information and a good theory. But if I make a tricky question on the scenario that you have read, you would still be confused. And even though you may know your topic, but unless you practice solving ADC style, it's gonna be difficult in the exam, and then you get frustrated. I know my stuff, why did I flunk? Because you didn't know, you did not practice the way exam is. But then who is going to give you those questions, So either you make it yourself, or you just pray that somebody makes it for you. And so this would be my, I think 5th book that I would be making. I have made 2 books on MFDs, then I've made 1 book on DHA, that's Dubai Health. Then I've made 1 All India Postgraduate Exam book. So yeah, this would be my 5th book indeed. What started as a passion and effort to help students like me all across, basically giving back to the community in 2010, when I made my first book on All India Postgraduate Exam of my own exam paper, which I had cleared and secured 42nd rank. Yeah, I think since then a lot of exams I've given and books I've written on it, which has helped I don't know how many countless candidates. If I remember correctly, around 800 copies of my AIPG book had been sold in the first 1 year. Then I didn't keep a track of it because I had given to the publisher and I just left it at that. Then MFD books altogether, I think 400 copies of that, two books together. DHA around 190, and let's see how much ADC gets taken. So I think this would be just one stop book for all the Australian Dental Council candidates. You can read your textbook, and then when it comes to solving, you can just solve those clinical based scenario questions. 500 questions is a lot, you know. If you revise that book enough, you are covering your infection control, therapeutic guidelines, ODEL, ethics and professionalism, questions most sought out after, public health, dentistry, new topics which ADC has been asking, and what was that one more? Ethics. Ethics I said already, right? One more I had mentioned. I forgot. But anyways, these five compilations basically. So you don't have to search to various different books. Now I'm restricting these questions from these textbooks only because these textbooks are a must reading, you know, for everybody. ODEL and therapeutic guidelines, ethics, public health, and infection control. Yeah, this was the fifth one. These three are, you know, you keep on gathering sources from where you can read, but there is no one particular source. So I have compiled from ADC journals itself. So these are all valid, sought out after explanations and sources, you know. It's not like something that I have made up. So this is one part that you definitely have to study, and then the other is solving the mocks. Now if you, I think you do these two, which is then it's just enough. We currently have 29 mocks. I'm preparing the 29th mock. You will see me solving questions from it. I'm on question number 25th at the moment, but I'll be solving just in between questions just related to the antibiotic prophylaxis. So I think, yeah, that's a lot of study materials, and that's a very organized way of studying instead of going through 10 different things and watching 10 different things. I think I'm easing your ADC journey, the part 1. Part 2 is your effort. I'm not coming into it. I'm done with it. So yeah, let's solve the questions. Okay. A 68-year-old patient is scheduled for a dental extraction. He has a prosthetic heart valve and is otherwise well. He is not allergic to penicillin. His INR is stable and his cardiologist recommends routine precautions. Okay, so a 68-year-old who has a heart valve is scheduled for a dental extraction. Now, does this patient require antibiotic prophylaxis before extraction? Am I mentioning surgical antibiotic prophylaxis or am I mentioning antibiotic prophylaxis? Surgical is for surgery site. Remember, antibiotic prophylaxis is in general. Now, you should remember one thing. Now, for this you have to go to TG and read, but anything which has related to valve, just please give antibiotics. So yes, he should be given a single dose of oral amoxicillin 2 grams before 1 hour before the procedure. Anything related to the valves, just go for antibiotic prophylaxis. That is one common thing in everywhere. It's not like you had a implant or any kind of valve 6 months ago or 2 years ago. No matter the timeline, anything related to the valve, just go for antibiotic prophylaxis. Straight as that. If this patient was allergic to penicillin, what is the recommended alternative? Clindamycin. Others are also okay, but clindamycin is the most common alternative. Now, which of the following cardiac conditions does not require antibiotic prophylaxis for dental procedure? Not require antibiotic prophylaxis, not surgical. History of infective endocarditis, does it require? Yes. Cardiac transplant with valvulopathy, anything related to valves, like I said, just give. Unrepaired cyanotic congenital heart disease. Unrepaired, it's not repaired. Unrepaired, yes. If it was repaired and if it did not involve the heart, then no need to give. But if it is unrepaired, any part of the heart, unrepaired defect, give. Coronary artery stent inserted 6 months ago. It's an artery stent, not related to the valve. Any stent is all right. You don't have to give. So the answer is D. Where did I go? Yeah. No, I skipped something, right? Yeah, coronary artery stent inserted 6 months ago. That would not require. Now, this is a very, very important question. A 55-year-old female with poorly controlled diabetes, HbA1c 9%, and no cardiac history is undergoing root planing and curettage, scaling, polishing, and root planing. Okay, she has poorly controlled diabetes. She asks if she needs antibiotic beforehand. Now, according to current guidelines, should this patient receive prophylactic antibiotics? Yes, no, yes, because periodontal procedures cause bleeding. Only if she has a history of cellulitis. Okay. Now, very important questions. How many of you think she should receive prophylactic antibiotics? If your answer is yes, you have done yourself a mistake. Why? If I would have asked you, should this patient receive surgical antibiotics? Then the answer is yes. Should this patient receive prophylactic antibiotics? No, because there is no cardiac risk factor. See, when you give a general antibiotic prophylaxis, it's to prevent infection with the heart. Or the patient has to be immunocompromised. That it will affect the heart. You are doing scaling and root planing, which will involve bleeding, but heart here is not mentioned to have been affected by anything. So would you give surgical antibiotics to prevent infection of the scaling site? Yes. Would you give general prophylactic antibiotics to prevent damage to the heart? There is no mention of the heart. She just has diabetes, nothing related to the heart. So no. Prophylaxis antibiotics will not be given. Surgical antibiotics would be given. So, would you ultimately be giving antibiotics to this patient? Yes. But is it for surgery? Meaning the blood which is going to be released from the surgical site to prevent infection of that site or to prevent infection of the heart. If there is no cardiac risk factors, there is no infection of the heart that is anticipated. Is an infection anticipated on the surgical site? Yes. So which antibiotic will you give? Surgical. But what does the question say? Prophylactic antibiotics. So no. Now you get my point. How I can trick you, how ADC can trick you into answering wrong by giving you the same scenario. So the answer is no, unless there is cardiac risk factors. Understood? Now, last question for the day. A 72-year-old male with a prosthetic hip joint. It's a hip joint, not cardiac valve. Okay, done 5 years ago. 5 years ago. Is scheduled for a dental extraction. He has no history of joint infection and is otherwise healthy. According to current guidelines, should this patient receive antibiotic prophylaxis before the dental procedure? Yes. No. Yes, if the dental procedure involves manipulation of the gingival tissue. Only if the patient is immunocompromised. Well, if they would have mentioned patient is immunocompromised, then yes, he should receive antibiotic prophylaxis. But is he immunocompromised? He is healthy. No history of joint infection. Plus, it was done 5 years ago. Right? So, unless the hip joint is 6 months old, less than 6 months old, you are not going to give prophylactic antibiotics to prevent. Okay, if it was less than 6 months ago, or if there was a history of previous joint infection, then you would have given to prevent infection in that joint area, which is very, very away from your dental area. But like I said, general prophylactic antibiotics is either for the heart or in general. When I say in general, it means if there is some artificial thing inside your body that has chances to get affected with the bacteria which you will be introducing when you're doing surgery. But he's healthy. It was done 5 years ago. So no antibiotic prophylaxis. Now again, in this question, I can tweak this question and tell you, same question. Prosthetic hip joint done 5 years ago is scheduled for a very complicated third molar surgery. Again, would you be giving prophylactic antibiotics or would you be giving surgical antibiotics? Surgical antibiotics. Then you would have given to prevent infection where? On the surgical site, not at the prosthetic joint area. Though the antibiotic is the same, the dose may be the same, and maybe it's just one single dose before the surgery. Everything is the same, but the reason that you give are completely different. You understand? So I hope this is so clear to you that you will not get confused. This is a very beautiful table that I have prepared. Please take a screenshot, put it on your dashboard, read it daily, and think of the scenarios. And when you get such a question in the exam, read double, like twice, search for the word surgical antibiotic prophylaxis or just plain antibiotic prophylaxis, and then only answer. So even though incredibly simple topic, the creation of the question can be so tricky that even if you know it, you'll commit a mistake and then you'll be like, OMG, right? So I hope this is clear. Let me know in the comments how this video was. Did it help you? And I think this is one of those masterclass videos that I've made for TMJ. You remember the splints? That was one stroke of brainstorming that I had, and wow, what views it has received. And so many people have messaged me that they are so thankful for that video, because it was a complicated topic. As you know, as dental graduates, you don't get in touch with so many TMJ patients, leave alone the splints that you give. You don't even know what is happening with the joint out there, except that, you know, it's a Ginglimo diarthrodial joint, you know, that definition. No, we should have more classes on TMJ, you know, by the oral surgeons, by the postgraduate students, with all videos, because it's just theory. It gets, after a while, you just stop listening. You just get lost somewhere in those terminologies. So anyways, I hope this is very clear, and it helps you become a better clinician, and that you are able to explain this topic better to some other person who's confused. So yes, have a nice day. Bye bye.